Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, what is the disease and the marker? If you see the diseases and markers, there are different diseases and their markers should be known. Like for ankylosing spondylitis or for Retter's syndrome and for acute anterior uveitis or for acute anterior uveitis. For these three, the marker is HLA-B27. Along with that, HLA-B27 is also a marker for juvenile arthritis. Pauciarticular juvenile arthritis also have HLA-B27 has not juvenile arthritis. It is actually anterior uveitis and reactive arthritis. I'm sorry. It is reactive arthritis. Then we have psoriatic spondylitis. So ankylosing spondylitis, Retter's disease, then reactive arthritis, acute anterior uveitis, and psoriatic arthritis. All these have B7 has the marker. Now, next we have juvenile arthritis. Juvenile arthritis, which is pauciarticular juvenile arthritis. This pauciarticular juvenile arthritis has DR8 and DR5 has the markers for pauciarticular juvenile arthritis. Then we have rheumatoid arthritis. Okay, in rheumatoid arthritis we have markers like DR4 and DW4. DR4 and DW4 are the markers of rheumatoid arthritis. Then we have Sjogren's syndrome. Okay, in the Sjogren's syndrome, the marker of Sjogren's syndrome is DR3 is the marker of Sjogren's syndrome. Then we have to see some more diseases and their markers. So after Sjogren's syndrome, systemic lupus erythematosus, the marker for systemic lupus erythematosus is DR3 and DR2 are the markers of systemic lupus erythematosus. Then we have gluten sensitive enteropathy. The marker for gluten sensitive enteropathy is DQ2. Then we have chronic active hepatitis. The marker for chronic active hepatitis or the marker for dermatitis herpetiformis is only one. For both these, it is either DR2 or DR3 is the marker of it is only DR3. DR3 is marker of chronic active hepatitis and dermatitis herpetiformis. DR3 is the marker. Then for psoriasis vulgaris. Psoriasis vulgaris is a marker for psoriasis vulgaris is CW6 is the marker for psoriasis vulgaris. Now if we see some more disease and their markers. Now, after psoriasis vulgaris, we have pemphigus vulgaris. Pemphigus vulgaris, marker for pemphigus vulgaris is DR4. DQ1 is the marker for pemphigus vulgaris. Then we have bullous pemphigoid variant. The marker for bullous pemphigoid variant is DQ7 is the marker for bullous pemphigoid variant. Then for type 1 diabetes mellitus, the marker for type 1 diabetes mellitus is DR4, DQ8, DR3 and DR2 are the markers for type 1 diabetes mellitus. Then Graves disease, marker for Graves disease and also marker for myasthenia gravis. Marker for Graves disease and myasthenia gravis is B8, DR3. B8, DR3 are the markers for Graves disease and myasthenia gravis. Then if we see the marker for adrenal insufficiency, marker for adrenal insufficiency is DR3. Then if you see marker for Behçet's disease, Marker for Behçet's disease is B51 is the marker for Behçet's disease. Then marker for congenital adrenal hyperplasia. Marker for congenital adrenal hyperplasia is B47. Marker for narcolepsy, good pastures syndrome. Then marker for multiple sclerosis. So marker for narcolepsy, good pasture syndrome and multiple sclerosis, for all these three it is DR2 is the marker for all of these three.
Thank you and thank you for watching.